Americans are lucky to have access to the best medical care on the planet, but the cost of healthcare in America is too high for many Americans, forcing some people into bankruptcy and causing heart-wrenching decisions between affording necessities like food and shelter or getting medical treatment. People who don't need to use the medical system often don't notice that healthcare is leaving so many people behind. So here are 5 ways the medical system is failing people in the United States. Number 5. Focus on treatment over prevention. About half of American adults above the age of 35 who are at a high risk of developing a disease like cancer are not receiving medical treatment to prevent serious illnesses. So people are developing much more serious diseases when they could be on prescription drugs and other treatments to eliminate or greatly reduce the risk of developing a serious disease in the first place. Number 4. Profit-driven healthcare. Private hospitals are striving for ever-increasing profits. The cost of medical treatment is surging upwards, and so are the medical bills for the average American. 1 in 5 Americans are being harassed by debt collectors over medical debt. The medical system also lacks transparency. It is often difficult to navigate how to get treatment or affordable treatment, and people pay more than they have to for healthcare because it's difficult to compare prices of the same treatment or prescription drug between different healthcare providers. Number 3. Lack of health insurance or not enough health insurance. 26 million Americans lacked health insurance in 2024. Add to that, 1 in 4 Americans lack enough health insurance, meaning that their out-of-pocket expenses for medical treatment are still unaffordable. Number 2. Insurance often only covers a fraction of very expensive medical procedures. A dreaded diagnosis of a life-threatening illness like advanced cancer is stressful enough, but people with health insurance don't realize just how much of their treatment isn't covered by their insurance, leaving the patient stuck with a hefty bill while deathly ill and unable to work. For example, studies show that half of all breast cancer patients face serious or catastrophic financial burdens, such as maxing out credit cards, being unable to pay for groceries and rent, losing their homes, and filing for bankruptcy. And number 1, the cost. Many people simply cannot afford healthcare. A majority of Americans who lack health insurance cite the cost of insurance as the reason why they don't have coverage. And a single medical emergency can lead to financial ruin for Americans who are uninsured. For example, someone who has a heart attack can be stuck with a $200,000 medical bill, which is unaffordable for virtually everyone. So don't forget to write your federal and state governments asking for more affordable healthcare. So that's all for this video. Visit News in 5's YouTube, Instagram, and X, formerly known as Twitter, pages often for our future videos and other content. Don't forget to subscribe to the News in 5 YouTube channel and social media pages. Remember to check out our website, newsin5.net. Visiting our website as often as you can is an excellent way to support News in 5.